Stroke is the fifth leading cause of death, but a leading cause of long-term disability, according to the CDC. May is Stroke Awareness Month, and medical professionals say strokes are preventable, but it's critical to know the signs. Carolee McGrath sat down with Angela Smith, manager of the stroke service at Holyoke Medical Center, to learn more about this often silent killer.
Well, the American Heart and Stroke Association designated May as Stroke Month, and it's just important for people to be aware that strokes are the fifth leading cause of death, and it used to be the third, and now it's up to the fifth, so that's good. We've made progress in the last 12 years since I've been in my role, so it's important to have public awareness, opportunities like today.
And if you could describe what happens to a person when they're having a stroke, because you hear different people having different symptoms.
Right, and the best analogy I can use, it's like a brain attack. So when you have a heart attack, a blood vessel is blocked. Same thing happens in the brain. A blood vessel can be blocked, and that's 85% of the time. And about 15%, the blood vessel can burst or ooze blood. So that's what's called a bleeding type stroke. So it's a blockage or a bleeding type stroke. And when that happens, the circulation's impaired, which means you're not getting blood and oxygen and nutrients to the brain, and brain tissue dies immediately. So you really have to seek help immediately when it's involving the brain.
And what kind of symptoms occur? Like you can have loss of feeling?
Right. It depends on where in the brain the stroke happens. So if the brain is having it in the back part of the brain, you'll have a lot of dizzy symptoms, almost like you're having vertigo or problems with dizziness. And then if it's in the mid-back, you could have a visual field loss where you could be driving a car and all of a sudden a field cut could happen. And we see people that will come in and they'll hit a couple parked cars and we're alert, like maybe they have a stroke in that area. And then they have a stroke, can be in a speech center, it can be in the frontal lobe, which can cause personality changes. So the stroke diagnosis is really up to the physicians in the hospital to diagnose you, because it can happen anywhere in the brain, the symptoms vary.
And sometimes people don't know what has occurred.
Right.
For example, they could have symptoms, for a few days where they're not really putting things together, and maybe they had a stroke and it went undetected. How important is it not only to get into the doctor, let's say they're saying things that maybe seem a little bit off, they're not putting things together, and do you have to kind of demand, hey, can you do an MRI to verify that this has happened? Like how do you advocate for yourself as a patient?
Right. Well, when you are different from what's called your baseline, your normal day-to-day, and people will notice they're struggling with their words or forgetting things more than the normal, forgetting the keys, or having weakness on one side. What usually happens with a stroke, though, it's a sudden onset, which means you're holding your coffee mug and then it drops. So that means the blood vessel has right then blocked. Sometimes you can have a transient symptom called the TIA, which the symptoms come and go and come and go. So that's where you see those symptoms over a period of a week. And then when it completely blocks, then you'll see complete problems with someone's speech, with their arm, with their leg, with their gait, walking, and things like that. So it's just really important to kind of know when those symptoms are happening, to seek medical attention right away, because when we do, we will figure out why you had that stroke.
Right.
And that's where you need the carotid studies or the MRI, and you need to check your heart. So there's an array of diagnostic tests we do.
And so what about as far as, who typically, who are the people who are typically most at risk of getting a stroke? You hear about these tragic cases where young people will have a stroke, but what is the basic age range?
Yeah, we've had young patients, and those tend to get a lot of attention. And in the population, honestly, statistically, unfortunately, it's around retirement age. It's anywhere from that 65 to 75-year-old is the most vulnerable group for stroke. And you would think it'd be older, 80-year-olds, but it's not. We see more people in the 65 to 75-year-old age range, so it's important for people to know. And men and women are pretty equal when it comes to strokes. More women die from strokes, and I think it's because they live longer, and statistically they come into that population.
Okay. What about recovery though? Because I think sometimes people, they hear, oh, gosh, a stroke, and how are you going to recover from that? But there are some really amazing rehab programs now.
The recovery is based on if you seek medical attention right away. If you come into a hospital within 3 hours, you can be eligible for a medication to dissolve that clot and then restore the circulation, and whatever deficit they had will often reverse. And sometimes it's a very devastating stroke, so it can be less devastating. And otherwise, sometimes it's just a small vessel stroke where you'll just have something small and it'll recover. And now there's a second line, which is called a thrombectomy, where if it's a stroke has a blood vessel clot in a large vessel, they can go in and pull that clot out. They put a catheter through the groin and they pull that out, and that can also restore circulation as well. And that's only maybe less than 10% of maybe strokes, maybe even 7%.
But there's also speech rehab, people who are able to work with patients on their memory and recognition of people and names. I mean, there's so much that goes into the recovery process. It's so amazing.
And within 24 hours of someone coming into the hospital, we have the whole team already seeing them. Occupational, physical therapy, speech therapy if needed. So we establish a plan right away, and there's so many things that people can get so much better just from that recovery, and there's rehabs that are dedicated all throughout this area. We're very fortunate for stroke care.
So the key is awareness, right? If something doesn't seem right in your loved one in particular, because maybe sometimes, your mother or father, they might not realize that something is off, but you really have to be, aware of those changes in behavior.
Absolutely. And then you have to be aware of what your risk factors are, because that kind of ups the ante. So if you don't have high blood pressure or diabetes, your risk is a little lower. But if you start having high blood pressure, high cholesterol, diabetes, you smoke, you have obesity, and inactivity, things like that, those are all contributors to stroke. So if you do have those risk factors, you may be having a stroke when you have these symptoms for sure.
Right, so you have to definitely be aware.
You have to be aware and partner with your physician and get yourself on track.
Okay, Angela Smith, thank you so much for joining us. It's such an important topic, and it affects so many people.
It is.
And it's great to hear that there's hope in recovery as well. Thank you.
Thank you.